Hi everyone, and very good evening to all of you. So I hope you all are fine. And in that next session of this one, we'll discuss a lot about the stains and fixatives. So why is this session important? For two reasons. Number one, this topic is never covered in most of the classes, and I am also not able to cover in my own classes because of various reasons, the time being short. But this one topic which dreads the most to the students, isn't it? So when you look at the stains, there's so many of the stains, there's so many of special stains, and not to forget the fixatives. Now, before we move forward to this entire lecture, we have some things to keep in mind. Number one, let us first see that whether everything is okay or not in the live video. So, first of all, we'll try to answer a few questions. Number one, how much do you know about the stain and fixatives? How much you are confident when you solve the MCQs? So, there are various questions that is asked on stains and fixatives. Few of the questions are directly asked. For example, the pass is a stain of, or a Sudan black B is a stain of. Now, few questions are indirectly, like they give an image and then they ask to identify which structure it might be. Okay, but when you look at these images, don't look exactly at the image only. Let's see the image and the history and all together, and then see whether it can lead you to something or not. But before we move there, we have something more to understand, and that is about the fixatives. So what I'll do is the entire video I have divided into two parts. Number one is the fixatives, and once you finish the fixatives, we'll then move to the special stains there. Okay, because it's a live video, you are all encouraged to ask me as many doubts as you want to, and you can, and so that we can cover this topic as much as possible. So very warm welcome to all of you. For those who are watching this live, yes, Detective Story Active and Avinash Mukherjee, very good evening to both of you. Let's start this topic with discussion of the fixatives. Okay, number one, first of all, where have you seen them fixatives? A fixative, when you come to the term fixative, often what comes to our mind is, number one, we take a Fevicol and we fix something to a something. That means if I to fix these two fingers to something, I need a Fevicol. Now, does that Fevicol exactly mean in pathology? Let's find it out. So, fixatives, what are those? Anything in pathology which will actually preserve a slide. Please understand, anything in pathology which will actually preserve a slide or its smear is called as fixative. The basic idea of fixative is to cause minimum distortion during the tissue processing. So because the tissue processing requires a lot of steps. Few of the steps that you must be able to understand is, number one, tissue fixation. It first will dehydrate the tissue. That means it will take all the water out of it. How do we do that? We do that by putting in the concentrations of alcohol. Then what we do is we try to cut the tissue and making it firm. And finally, before we stain a tissue, we have to again rehydrate the tissue. But whenever tissue goes through all the process of dehydration, rehydration, and the fixation, the firmness, what happens? The tissue may get distorted. To make the tissue ready for not getting distorted, we have something called as fixations. Okay, fixations. So what are the only advantages? It requires any tissue so that it does not undergo bacterial degradation. It will ensure a good staining. It will ensure that the tissue is not autolyzed by the lysosomal enzymes, and also a special stain when done will take a stain very fast. What are the types of fixations? You all are aware of this very common method of fixation called as heat fixation. But the question is, does heat fixation work in pathology? That means, does heat fixation actually work in histopathology? It works in pathology, right? The answer is no. What is heat fixation? It will fix your smear to the glass slide. That type of fixation will only fix a smear to the glass slide. It will not prevent the further tissue modification by the further steps. So we don't rely on heat fixation much. We rely on some other methods. And what are those? Let's move forward. The basic fixation method here is actually something called as chemical fixation. Yes, it's called as chemical fixation. Now, what is chemical fixation? Chemical fixation utilizes any organic or inorganic substances to preserve morphology. Now, this question has been asked recently in the I9 CET, last year even, and the question was, the main types of fixation are, number one, they can be coagulant fixation, they can be cross-link fixation, and they can be compound fixation. Let's start with the coagulant fixation. What are coagulant fixation? As the name says, it will coagulate the proteins, right? Simple. Yes, it is very simple. A coagulant fixatives, they actually will coagulate the proteins. Now, we have to understand what are the examples of the coagulant fixations. So, they are alcohol. You might all be remembering alcohol like methanol and ethanol, right? Methanol, yes, methanol is a fixation. Most of the smears also, like before we're doing a Giemsa smear, Giemsa staining in a hematology, we often use methanol as a fixator. Ethanol is a very commonly used fixation again. Acetone, picric acid, and trichloroacetic acid are the other fixatives which actually work by coagulating the proteins. When you coagulate the proteins, the protein will not degrade further when you process the tissue for the further tissue processing. Now, see, there's something called as cross-linking fixation. Now, this question was asked recently. This question was asked recently in the AIMS exam. What are the examples of cross-link fixatives? Okay, let's first understand what does a cross-linking actually cross-links. It cross-links proteins and the DNA, as well as DNA and the proteins. That is, it will actually cross-link the protein and DNA to the cell wall, and it will also cross-link the protein and the DNA itself. Now, what are the examples? Examples are formaldehyde, butyraldehyde. It will actually use mercury chloride, zinc chloride, and will also use osmium tetraoxide. Now, this question was asked in the recent I9CET that which type of fixative it is. It's a type of cross-link fixatives. So, look at the examples. Very commonly, you have heard about them. Formaldehyde, butyraldehyde, mercury chloride, zinc chloride, and osmium tetraoxide are the basic fixative that you must all be aware of in histopath. So, out of these four, can you answer this question in the live chat? Dash in its 10% neutral form buffered solution is the most common fixation used in histopathology. Can you answer this question? Which is the most common fixative solution used in pathology, and that is used in 10% neutral buffered form? Now, can you answer this question? Let me see how many of you can answer this question. Let me see how many of you can answer this question. The answer to this question is, I hope many of you are correct. Yes, it's 10% formaldehyde. Formalin. Yes, formaldehyde. Very, very good. Very, very good. Formaldehyde. Very, very correctly answered by Avinash Mukherjee, Megha Tyagi, Chandrika. Exactly. The answer is formaldehyde is the most common fixation used in the tissue histopathology. So before I move forward, let's go back a bit. Okay, let's go back a bit. So what we should understand here is number one, dekho. First of all, I told you about the coagulant fixatives. Examples are alcohol, acetone, picric acid, and trichloroacetic acid. Done? Okay. Okay. Next one. If we talk about the cross-linking fixatives, the cross-linking fixatives are formaldehyde, butyraldehyde, mercury chloride and zinc chloride, and also osmium tetraoxide. Osmium tetraoxide. Not to forget, the most common being formaldehyde. Yes, we have some other answers also. Chandrika, Kanchan, Harsh, Meghna, and Praveen SR. Very well answered. It is actually formaldehyde. Okay, let's move ahead. Let's now talk about this very commonly asked question, fixation for electron microscopy. If you have the option of this one, go for it. No doubt about it. So butyraldehyde is the most common fixative used for EM. But if you have a choice of butyraldehyde and formaldehyde, there is also an option. But having said that, the best answer is, no doubt about it, butyraldehyde. Now, one of the previous, past years NEET question was one option with Carson's modified melanics. So this was one previous question. I have not seen this question quite right now, but yes, if again I repeat here, if the choice is butyraldehyde, go for it, no doubt about it. Okay, sure. Now, there's one more fixation which often fixes the not a tissue but cells. So any fixative fluid which stains a cell is called a cytological fixation and fixatives. Okay, it will stain what? It will fix the cell there. Okay, so solution of ether and 95% ethanol was used, but this one is no longer preferred. It's not preferred nowadays. So do you know what is the preference you take nowadays? Any idea this question? So I have this question for you. Dash is now employed as the most common fixation for Pap smear. Pap smear is the best example of cytological fixation. So can you ask this question? What do you think is the answer here? Dash is the now employed as the most common fixative in most of the laboratories. So any idea what is your answer here? For Pap smear, it is, yes, the right answer is we don't use any ether because ether has a fire hazard. It will actually as a fire hazard to laboratories, and laboratory have crunching spaces, so we don't prefer that. Answer should be 95% ethanol. Again, was asked as recent year exam questions, so make sure you always try to remember this. The answer to this question is 95% ethanol. Okay, right answer is 95% ethanol to this question. So let's move forward. Well, something new. Well, this new can be definitely be asked, especially in the COVID scenario. Suppose you want to transport a slide from one city to other city. Can you use something? Yes, you can use something called as coating fixatives. Coating fixatives. The coating fixatives are just like a spray. You use a deodorant. Similarly, you have a slide. You can spray it on a slide. An example is polypropylene glycol. MCQ can be asked as carbovax and diaphane fixatives. The two fixatives which can be used as a coating fixatives on the glass slide. Okay, so yes, we have one more fixative called as coating fixative. It's like a spray which can be sprayed on the slide. Is sprayed from around 10 to 12 centimeters away from the glass slide. Okay, next, Bouin solution. Now you can't forget this one. Bouin solution is a solution which is very used only for some special circumstances. You can use it for GI biopsies, used for animal embryos, for endocrine organ tissues, and definitely for testis biopsy for sperm morphology. Remember, only for sperm morphology, we don't use it for suppose a testicular carcinoma diagnosis. Will take again 10% neutral buffered formalin. But if you have to look for sperm morphology, you have to take it in Bouin's fluid. Okay, you have to take it in Bouin's fluid. So again, look at some major points before I move to my next topic of special stains. Ensure you remember few basic points. Number one, the first basic point I told you was this one: types of fixation. Physical fixation and the chemical fixation. Chemical fixation has coagulant, cross-linking, and compound. The moment you call about coagulant, for coagulant, remember the alcohols. Which alcohol? Examples are alcohol, ethanol, methanol, acetone, picric acid, and trichloroacetic acid. Questions have been asked on alcohol is a type of coagulant fixatives. Next question recently asked last year was on cross-linking fixatives. They cross-link the protein and the DNA. And examples are formaldehyde, glutaraldehyde, metal salts like mercuric and zinc chloride, and also osmium tetraoxide. But the most common being the first one, formaldehyde. Okay, two things are covered. Next one. Then we talk about the EM fixative. The best answer is glutaraldehyde. Okay, glutaraldehyde is the best answer. Next, how to fix a pap smear? Answer is 95% ethanol. 95% ethanol is the best fixative for pap smear. Okay, next one. Can we use something as a spray for coating for transporting slides? Yes, you can. And the answer is carbovax and diaphane fixatives. Carbovax and diaphane fixative. Remember, this has CD. Okay, carbovax and diaphane fixative is CD. Finally, Bouin solution. This is used especially for GI biopsies, embryos, endocrine organs, and for testis biopsy, especially if you want to look for the sperm morphology. Well, this is not been asked, and I think it can be the next question. They have asked a lot of these fixatives. This can be the next question. Very a term that you cannot forget when you listen to it. Saccomano. Very that term is always there in the pathologist's mind. Saccomano. It's very fond of this term. Saccomano. Saccomano fixative is used for fixation of sputum, but cannot be used for fluid fixation from other side. That means simply it is used for fixation of a sputum. Okay, for sputum you can use S for S, Saccomano. So I don't think it's very tough. S for S. The previous one was CD. Diaphane and carbovax is used as a transport fixative. So we have understood till now. If you have any questions, you may please ask me. Else, I'll move to my next lecture part, and my next lecture part will be on special stains. Till now, I think you might have just understood few things. Fixation. The basic reason of fixation is to preserve the tissue morphology in its state so that it will not change when we do the tissue processing. Fixation, it can be heat fixation or can be chemical fixation. Chemical fixation can be a protein fixation, that's a coagulant fixation, or can be a fixation like a cross-linking fixation. Now remember the examples of the coagulant fixations and a cross-linking fixations. Try to remember a few basic examples like Saccomano's, yes, very important. S for S, sputum. Any transport fixation, yes, and one is a pap smear fixation, that is 95% ethanol. However, one more thing is for EM what we use is glutaraldehyde. Okay, so Carbovax comes under which type? It is usually is a cross-linking fixation and or cross-linking fixation. Okay, let's now move to special stains. My next topic is a special stain. Again, very interesting topic. So why do you need to special stain a tissue? We often use a special stain because we are not able to guess correctly what is the finding in histopath. So we use a special stains. A special stain has some categories, and I'll just list it out into major categories, which is like for looking for any structure, or to look for any microbial products, or it will actually done for looking for any structures, microbes, or can be used for looking for minerals or pigments. Let's start with the very important nowadays, that is Warthin study. So Warthin study, it has been used always as that for spirochetes. Now spirochete is stained black. Look at the black color here. Look at the black color. You observe here. This is what is black color. These all are the spirochete stains. Okay, these all are the spirochete getting stained by the Warthin study. But also remember, it can also be used for H. pylori. Look at this H. pylori getting stained again by this Warthin study. Remember, H. pylori is a gram-negative bacilli and is often diagnosed in a case of chronic gastritis. Okay, chronic gastritis. Remember, so this is H. pylori and this is spirochetes. But nowadays, there's one more thing that you should know, especially in the fungi, and it is gomori-methamine staining. The gomori-methamine staining, called as GMS, is often referred to as gomori-methamine silver staining, GMS stain. Now look at this. This is a fungus. This is a fungi. Often fungi are diagnosed on the basis of the branching, whether branching is acute branching or branching is a obtuse branching. So acute branching usually is A for acute, A for aspergillus. And this type of obtuse branching usually is rhizopus or the mucor. Now this is actually a GMS staining, but the same can also be stained on a PAS stain. Now this is actually a PAS stain. What is it? It is actually a PAS stain. Now PAS stain again can be used to stain a fungi, especially its cell wall. So yes, now I'm giving you this one, and you cannot forget this one, especially if you are going to attend for this year's INICT. So what do you think is this? This actually is a GMS staining on a patient who has blackish discharge and disruption of the nasal septum presenting post-COVID, and he is diabetic. It was first seen on a KOH smear and then was actually done with a GMS staining. So can you identify what is this? Look at the broad septa. Look at the broad septa and it's aseptate septa. There is no septa. It's broad and aseptate. Look at the broad septa here and look at the aseptate septa. This actually is pointing towards what? It is pointing towards, yes, mucormycosis. Yes, dichotomous branching, aseptate. It is pointed towards a mucormycosis. Not to forget this, it is definitely should be understood, especially in the post-COVID diabetic patients who are having a blackish discharge or blackish discoloration along with disruption of the nasal septa or can be thickening of the nasal mucosa seen on MRI or scans. Yes, this can be a case of mucormycosis. Chalo, next one. Now this is cicata or scene. A cicata or scene is actually done for looking for HBsAg. So this is the hepatitis B HBsAg antigen inside the hepatocyte. It is often pointing towards what? This often points towards a ground glass appearance, and then the patient stained with HBsAg pointing towards nothing but a chronic hep B. A chronic hep B often shows something called as ground glass appearance. So if a patient is showing you in biopsy of the liver a ground glass appearance, then always think about it can be a case of chronic hep B, and so the patient should be tested for the stain called as cicata or scene stain, which is actually looking for the HBsAg antigen, HBsAg. Okay. Structures. Let's look at the structures now. Now in the structures there is an acidic mucin of goblet cells. Now there's very confusion that what is a mucin. So I'll just clear it off. When we talk about the mucin, we have three stains. Please listen to me carefully. Mucin should always be looking at three stains. Number one, it can be mucicarmine, the best stain. Second, Alcian blue, and third is PAS. The problem of PAS is PAS stains what not. Often we say in pathology, is there any structure in actually in a world which is not stained by the PAS? We don't get a lot. So before you move to the PAS, let's first look at the stain name. Alcian blue. Now remember, A for Alcian blue, A for acidic mucin. That's it. Remember the one thing. Now, where do you get acidic mucin? In the goblet cells. Okay, do you get the point? So these all area you're seeing, these all blue cells, these all cells actually are the goblet cells, often seen positive in a case of acidic mucin in goblet cells. So often a Barrett esophagus will stain this very positively. Now, mucicarmine is a stain which often stains a neutral mucin. But you see, mucicarmine is a stain which is staining not, it is a very sensitive stain, but it's a very specific stain, but not a sensitive stain at all. So often we don't depend on the mucicarmine stain. Now you might get confused. So you have told about mucicarmine, you have told about the Alcian blue, but what about the PAS? Here comes the PAS. See, the stain is called as AB PAS. A very important component of AB PAS is, if you look at this whole thing, look, this is blue, right? This whole blue area staining here is Alcian blue stain, and all this pink area are PAS. Well, both of them are mucin. Yes, both of them are mucin. So what is the basic advantage is, you can look for the acidic mucin. AB means Alcian blue. Okay, AB means it is Alcian blue. So by looking for the Alcian blue, you can look for the acidic mucin, and you can differentiate it from the PAS, which will actually look for the neutral mucins. When you look for the neutral mucins. So if you want to look for the mucins inside stromal tissues, you can use PAS. If you want to look for the mucin which is acidic in nature, do AB, that is Alcian blue. Otherwise, the non-specific, I should not say non-specific, but actually more sensitive. A very sensitive stain is actually what? It is very specific stain, not sensitive, sorry. Very specific stain is the mucicarmine. But how problem is, it's not very sensitive. Okay. Next one is oil red O. Look at this red color structures. These all are the fat areas. All are the fat areas. Now this is an example of fat emboli in the lung, which can be diagnosed with a case of oil red O. Now question that was asked recently is, oil red O stains what? The answer is a fresh tissue lipid. If you want to stain in a fresh tissue lipid, you will use oil red O. What does it mean? That it means before doing a fixation, if you want to look, before looking for the fixation, if you want to stain a lipid, use oil red O. The use of the oil red O, used for the Sudan black B is often used for looking for a myeloblast or ALL3, or can also be used for looking for the lipid which is now often is seen in a tissue which is fixed now. Okay, that's used as a oil red O. But the basic use of again I'm saying not oil red O, the Sudan black B. The Sudan black B basically is used for looking for myeloblasts. It can also be used for looking for the ALL3 morphology cells, which is often in Burkitt lymphomas. And don't forget, the lipid can also be stained by it. Next one, connective tissues. Now here comes a big questions that often students ask me. So many stains, how to remember it? Before I move forward, let's have a quick revision for all the stains I have given to you. Let's quickly revise it. Number one, देखो, till now I have mentioned about silver starry stain in spirochetes and H. pylori. Okay? Then I mentioned about the gomori methamine stain, as the stain can be used for looking for fungi. The PAS can also be used for looking for the fungi. This can be a question this year, is pointed towards the aseptate broad dicotyledonous branching septate aseptate fungi, which often is pointed towards the rhizopus. Yes, it can be mucor, but with that, it can also be rhizopus, but it's pointed towards mucormycosis, especially in a case of post-COVID diabetic patients and a blackish discharge. Okay, cicata Ornstein is a stain often used for the HBS AG in a chronic Hep B case, especially in those cases showing a ground glass appearance. I then talked about structures. Now in structures, first is the acidic mucin stained by the Alcian blue. Mucicarmine is a very specific stain, but is not very sensitive, so often we don't use it. But yes, the color is, as you see here, it's pinkish in color. We can also differentiate a neutral mucin along with the acidic mucin by using a combined stain called as AB PAS. So AB is the Alcian blue, A for acidic, and PAS will stain the neutral amount of mucins there. Okay. Now we come to the oil red O. In the oil red O, we have used a fresh tissue lipid. Now this word fresh tissue lipid was recently asked in the AIMS exam. Now make sure that you know this. Okay, make sure that you know this. Chalo. Then is the Sudan black B. A Sudan black B is often used for myeloblasts and ALL-L3. But remember, Sudan black B can also stain the fat. Don't forget the fat also. It can also stain the fat. But for a fat, we often use what? Oil red O, especially the tissue is fresh in nature. So, any questions till now? Yes, that could have been rhizopus also, but with the clinical history, we'll point towards mucormycosis. Leverity stain in sphaerocytes, yes, you can use, but often used in microbiology. We don't prefer a lot of that in the histopathology. Yes, but very correctly. Okay, let's move to the pus. I told you what not is stained by pus. Everything is stained by pus. Look at the structures. It can stain glycogen, starch, mucin. I told you mucin. Which one? Neutral mucin. Okay. Bechambrain, alpha-1 antitrypsin. Now, this question was asked as PAS positive diastase resistant. I'll talk about this. Reticulin and fungi capsule are stained by the PAS. So, until now, I've talked about the fungi here, and let's talk about now all these structures. PAS, periodic acid shift. It often stains glycogen and all the structures here. But how to differentiate the structures? We often use a enzyme called as diastase. So often what we do, we first stain a structure with PAS and the PAS stains positive. Now when we PAS stain positive, the structure can be anything. Anything means the structure can be glycogen, starch, mucin, bechambrain, alpha antitrypsin, reticulin and fungi. But when we put diastase, what happens? This will actually decolorize to this. If it decolorises to this, it means the previous tissue was a pure glycogen tissue. If it is not decolorizing, it will not be glycogen, it can be anything else. And what are those? It can be, yes, these structures. Now you have a question, so how to understand whether these structures are there or not? Number one, look at a tissue and then look at the clinical history. Remember, alpha-1 antitrypsin this shows PAS positive globules which are diastase resistant. Diastase resistant. In fact, every other structure from here to here is diastase resistant, but glycogen is PAS positive, diastase sensitive. Now this is a very important question, how to look for a glycogen there, because glycogen bonds are broken by the diastase. Other bonds are not broken down, and hence we can't depend on diagnosis of the other structures. We can only depend on diagnosis of the glycogen there. Okay. Yes, Whipple's will also show the PAS, and that why Whipple shows PAS? Because the cell wall of the bacteria, remember, we can add here the bacterial cell wall, which contains peptidoglycan, they also stain with PAS, but these are PAS positive and diastase resistant. Very well put forward. It is also be positive in the Whipple's disease. Very well answered. Okay. Now let's look at the Masson trichrome. Beautiful staining. Look at the beauty there. Beautiful, isn't it? Masson trichrome has three colors. Trichrome, three colors. See, this is what? It's a red color. It is what? It's a muscle. Look at the blue color, and the blue color is what? It's a collagen. So muscle and the collagen. Muscle and the collagen. And along with this, there is one more thing. All the nucleus will appear black. And the greenish blue-green color is by reticulin. What is reticulin? Reticulin are the initial fibers which may progress to form later on collagen. Reticulin are the initial collagen fibers which will initially getting formed. They're just fibers. They're not thick bundles. Bundles are collagen. The thin fibers are reticulin. Reticulin can be stained blue-green in color by Masson's trichrome. Okay, Masson's trichrome. Plus, for elastin, we use von Giesen. Von Giesen is often used for elastin tissue. Von Giesen for elastin. Von Giesen for elastin. Okay, now this is actually an aorta. So how can a history be given? A history can be given with, suppose, a Marfan syndrome. So a patient has a degeneration of elastic tissues. It can be because of the mutation of the TGF-beta, which are often seen in Marfans. In that case, again, these all elastin will be degraded. Okay, degraded. Okay, this is von Giesen for elastin fibers. Now, this question was asked recently in the AIMS exam. So Gordon and sweet reticulin. Gordon and sweet reticulin is for staining it black in color. What does it stain? It stains the reticulin fibers. It stains what? It stains reticulin fibers. It stains what? it stains reticulin fibers. Okay, these all are here reticulin fibers. Okay, what is the full name? It is Gordon and Sweet. This question was asked recently in the AIMS exam. Please understand and try to remember this. Gordon and Sweet reticulin stain. Okay. Next is Mallory phosphotungstic acid hematoxylin. So often you see, if you have to see muscle cross striations, look at the striated muscles cross striations. You can often use something called as the Mallory phosphotungstic acid hematoxylin. Now this is not asked yet now, but if it is asked, look at the phosphotungstic acid should point towards the muscle cross striations. Look at the beautiful looking muscle cross striations here. Beautiful looking striations here is very beautifully seen here. Okay, look at the striations here. Okay, it is often seen in the Mallory's phosphotungstic acid hematoxylin. Okay, Congo red. Now this is one something which you cannot forget. It is Congo red. Okay, it's Congo red. And Congo red, you see, this is the staining you often get. It's a bright pink color. The same thing can be seen on the apple green birefringence if you look at the polarized microscopy, which proves that the structure here is not anything else but is what? It's a amyloid. Okay, it's nothing but a amyloid. Okay, so Congo red looks for a amyloid, and this is definitely the apple green birefringence. It's what? It's apple green birefringence for the amyloid tissue. This question again has been asked recently. It is all about the mast cells. Okay, mast cells staining positive for the toluidine blue. These all toluidine blue will staining the mast cells, and the same question can also be asked for basophils. The same question can also be asked for basophils. Toluidine blue for mast cells oblique basophils. Okay. Now we move to the minerals. Before I move to the minerals, let's have a quick revision of what we just studied. Okay, a quick revision. Number one. So, in this topic, we have talked about the PAS. On the structure stain positive with PAS, you can differentiate a glycogen by staining with diastase. Glycogen is diastase sensitive. Mason trichrome has three colors. Red is for muscle, the blue is for collagen, the black is for nucleus, and the greenish blue is for reticulin. But for reticulin, we have better stains. That is, one is Sweet Gordon. Remember Sweet Gordon? And Von Giesen for elastin fibers. Von Giesen for elastin fibers. Then Gordon Sweet for reticulin fibers. And the Mallory phosphotungstic acid for hematoxylin for the muscle cross striations. For the muscle cross striations. Let's now move to the toluidine blue, Congo red. These are the stains for basophils and the amyloid respectively. Let's talk about the minerals now. Prussian blue. You can't forget this. You can't go to exam without reading about this. These all are Prussian blue area, which is proving the area has iron. And which iron? Ferric iron. So remember, if this area has Fe3+, the ferric iron will combine with the potassium ferrocyanide solution, which is in this Prussian blue, to make insoluble blue ferric ferrocyanide. Blue ferric ferrocyanide. Okay, this a big reaction will prove blue in color is often showing the Prussian blue, which area? Fe3+, ferric, okay, ferric state. It often looks for the ferric state here. Okay, calcium. So calcium has two stains, Von Gossa, black, Alcian red is red in color. One question that you must understand is the basic use of Von Gossa is to look for the calcium in combination with phosphate. So if you want to look for calcium and phosphate together, that means in the bones, or any mineralized calcium, any sort of mineralized calcium. So if you think your calcium is not free, if you think that calcium is not free and is in mineral form, you can use Von Gossa. For all other calcium, you can use alizarin red. For the point, if you want to look for mineralized calcium with the calcium in combination with phosphate, you can use Von Gossa. Else, if you feel your calcium is free in the tissue, you can use alizarin red. So you can use alizarin red. Well, this question can be asked with a history of Wilson disease. If a patient has huge amount of tremors, he has say clear facial rings in his eye cornea, and if he has suppose a copper deposition in the liver biopsies, you can stain this by rhodanine, not rhodamine, rhodanine, N here, okay? Rhodanine stain can be used for staining a copper. Rhodanine stain can be used with staining a copper. Okay, remember this rhodanine stain. Okay, Massons Fontana or melanin staining. Now this actually is area showing you all the melanin deposition. it is in the basal cells, and the same thing is staining positive with a stain called as Massons Fontana. So Massons Fontana is often a stain used for melanin. Often a stain used for melanin. Okay, remember this? It can also be used for chromaffin, but you have been asked multiple times Massons Fontana, melanin, M for M. Massons Fontana, simple, melanin, it is M for M. Okay, M for M. So these are all the stains I have put forward. Let's have a quick revision of all the stains we can stain the minerals here. So Massons Fontana is a pigment stain, melanin. Before that, copper के लिए rhodanine. Copper के लिए rhodanine. Before that, calcium. Two stains, von Cossa and alizarin red. Then irons के लिए Prussian blue. For iron, there's Prussian blue. Then before this, we talked about a toluidine blue muscles. Toluidine blue muscles. Before that, Congo red amyloid. Phosphotungstic acid muscle striations. Okay. Cordon sweet reticulin black. What? Reticulin fibers. What is reticulin fibers? The early formation of collagen is reticulin. When this becomes bundle, you can use a Masson trichrome stain. For elastin, von Giesen. For elastin, von Giesen. Before that, Masson trichrome, the ever beautiful best stain ever. Okay. PAS for glycogen. To differentiate with the estase, you can use this enzyme. Before that, we talked about the Sudan black bean for myroblast, ALL3, and not to forget the fatty tissues. Then oil red O for a fresh tissue lipid. Oil red O for a fresh tissue lipid. Before that, the AB-PAS combination, beautiful stain for a PAS for neutral mucin and AB for Alcian blue acidic mucins. Then mucicarmine for is the most specific stain for the mucin, but it's not sensitive, so we don't prefer it a lot. Alcian blue, A for Alcian blue, A for acidic mucin. Before that, we have the structures, and it's all on all. Before that, we have also discussed about the cicata. Cicata, Alcian for HBS AG. Before that, this is the rhizopus, a mucor, maybe rhizopus, can be anything. It is a broad aseparate dichotomous branching septa. Now, comorimethylene can be used for staining a fungi. It can be also be stained by this PAS stain. Can always stain the PAS stain, but you understand PAS stains many things. Okay. Then there's pyroketes on a Barthin study, and H. pylori can also be stained by Barthin study. Not to forget, H. pylori can also be stained by this H. pylori. It can also be stained by the Giemsa. So Barthin study, here I was telling about the H. pylori, which can also be stained, which can also be used to stain the Giemsa stain. Can also be used to stain the Giemsa stain. So I think this was a quite important and revision for all of you. And just make sure you watch the last few seconds of this, few minutes of this video again. You can get all the important stains and their basic uses in one go only. If you like the video, please like the video. That is what you can do, at least for me, and subscribe to the channel. We will just come out, I'll actually come up with many other suggestions that you actually can give me in the comment section. I'll bring it to you before the INICT commences, especially so that you can revise in short whatever you could not have revised because of less time. Thank you all for staying live here and commenting and liking the video. If you have really liked the video, please also share with your friends, and maybe they can share with their friends also. Thank you guys for all your kind wishes. Let's meet again with discussion of more few topics as and where you actually want me to. Please put in the comment section. I'll surely discuss this again. Thank you. Thanks a lot. Really thank you. I really appreciate it. Bye-bye.